there may be a newer level of thinking, which is, wait a second, if these teams haven't been drilling, if a hospital perhaps doesn't have such a great safety track record, can you really just send a SWAT team in and fix it? And I think that's going to be discussed at the highest levels at the Centers for Disease Control. Is it possible to just sort of parachute in and fix things? Because I'll tell you, safety measures are tough to do, and they're a pain in the neck to do. They're not easy. It's a lot easier not to do them. And hospitals in general have been accused, or many of them have been accused, of just not being tough enough, not being rigorous enough. So I think questions will arise. Can you just parachute in and fix hospitals, or do you want to just designate certain hospitals that have a great track record?
Right, there's 4 hospitals right now that have these systems and buildings really in place to deal with outbreaks like this.
You know, Elizabeth, what sort of surprises me is the CDC, Tom Frieden just pointed out, he said in hindsight he wishes they'd put in a sort of a go team right away to get in there. Are we learning now that Washington needs to be there right away and make sure we're using the same protocols across the country?
I think we're learning that, but I also think we're learning that federal officials need to be less trustful of hospitals. Yeah. Over the summer, I said to federal officials, wait a minute, you're really going to trust that whenever anyone in this country walks in with a fever, that they will be asked travel history, when nurses are not used to asking that? You really think that you're just going to put out a couple of put information on the CDC website, have some webinars, and you're going to change the practice of thousands of nurses everywhere? And I think they really did think that would work. I think that the feeling was, well, we're telling them this, so they'll do this. And I think the feeling was that hospitals would sort of snap to it quickly. And I think they were a little bit overconfident about hospitals' ability to do all of these things.
Well, and it does raise the question, Elizabeth, was Texas Health Presbyterian up to this? There was the single Ebola patient, Thomas Eric Duncan. Now there are 2 more. These 2 new patients are in the care of this hospital. Are there concerns that this might not be the right place for them?
I think there definitely are concerns. I'm hearing it from officials. I heard it even earlier from safety experts. It's really 2 separate things. One is treating an Ebola patient and saving that individual patient, which can be complicated and which often involves being very aggressive in getting experimental treatment. The second issue is keeping the workers safe. And I think there are concerns that this hospital is having trouble with both of those things.
And now they've got a second nurse who now they have to go back and immediately do that, what's called contact tracing, right, where they have to find every single person that a health aide or health worker was in contact with. Then you've got a bigger pool of potential infected patients.
Well, hopefully that pool will be small, as it was with Nina Pham, and I'll tell you why. They don't have to find every single person who this worker came in contact with over a period of days. They just have to start when they started feeling sick. You are only infectious when you're sick with Ebola. So they just have to ask the worker, when did you start feeling sick? Who did you have contact with from that time until the time you went to the hospital? So Nina Pham is only one person.
One thing about nursing in particular, and health aides and the people who are really in direct, constant contact with the patient, Elizabeth, these are people who are really, they're especially if you're treating someone with Ebola, if you're a nurse, it's kind of nerve-wracking to think of how much contact you're having with protocols that are not really set in stone here.
Well, it's interesting. I think the protocols, they're not set in stone, but the protocols are pretty established. Right. It's practicing those protocols and having a team approach. I think whatever profession you're in, you know that your team performs well when you're a team and when you've drilled and when you've had meetings and you've thought it through. If that hasn't happened, it's hard to perform. I think nurses may be especially at risk because they just spend more time with patients than the doctors do. A nurse who just treated Ebola patients said to me, we're talking liters and liters of bodily fluids. I don't want to get too graphic, but it is copious amounts of fluids coming out of these Ebola patients, and keeping that, off your skin and keeping that out of your that's not easy.
Elizabeth, we're going to let you go in a second. You have to let you do some reporting.